Hey, it's Ashley back with episode 3 of Sandwiched In. If you're just now following me, I'm talking about taking care of my aging parents and young children. In this particular episode, I'm going to be talking about health insurance. So my dad is paralyzed from the waist down, and he's transitioning out of the hospital into a rehab facility. The hospital gave us a list of providers that could take him, but the insurance is going to be the one that actually makes the deciding factor. Why is this important? Well, it's important because you want to know if you're going to have to pay anything out of pocket or not, or if it's going to be 100% covered. My dad has Medicare. Prior to this, kind of had a little knowledge of Medicare with my mom because she has multiple sclerosis, but I wasn't an expert. So I've done more research and I want to share it with you so that you can understand. So my first point is, who does Medicare serve? Medicare serves people that are 65 years and older, people that have certain disabilities, and people that have end-stage renal disease. So if you know anyone with those particular characteristics, at least let them try to apply. Now, how does it work? It is a federal-based program. So that means that Medicare is the same across the board. Whether in California, Georgia, Medicare is the same. But it does have 4 different parts. So Part A. Part A covers hospital stays, skilled nursing home facilities, hospice care, and some home health care. Why is this important? It's because if you need anyone to come stay in the house with your parents, it may be covered under Part A. They can give them a bath, assist them with cooking, things of that nature. Part B covers outpatient care, like doctor services, preventative services, and it also covers some health care too. But the preventative services is more like shots, vaccines, just making sure they stay healthy. Now, Part C and D is under the Medicare Advantage plan. This is a plan that you actually have to pay additional funds for. So if your parents are drawing Social Security, they will get Part A and Part B taken out of their Social Security. I didn't know that. But Part C and D, the Medical Advantage Plan, is something that you'll have to call around, look into, and see what plan works best for you because it's going to cost money. Part C covers dental, hearing, and vision. And then Part D covers prescription. Part D is important because with my mom having multiple sclerosis, her medicine is very expensive. If she didn't have Part D, she wouldn't be able to take her medicine. So it is a good investment if you can afford it. Now I'm going to talk about Medicaid. So who does Medicaid serve? Medicaid serves individuals that are low income based. So it's not an age-based program like Medicare. If you're a child, pregnant, elderly, disabled, Medicaid can cover you. Now, if you have Medicaid, you can be automatically enrolled in Medicare once you turn 65 years or older. So I would always encourage anyone to do both so they can be dually covered. Because if you have Medicare and something is left over for you to pay, Medicaid will pick it up. So it's best to have both. Now you can go to the Social Security website, ssa.gov, to apply for Medicare. You can apply by phone at 1-800-772-1213. So that number again is 1-800-772-1213. Again, I'm writing this information down as I go. As I learn information, I'm sharing it with you. Now for Medicaid, you go to healthcare.gov to apply. Or you can go to your online state Medicaid website and it'll tell you what the qualifications are. I do know for sure that you're gonna need proof of income, a tax return, proof of residency like a utility bill or a lease. You're gonna need your Social Security card, your birth certificate, driver's license, or state ID when you're applying for Medicaid because it's income-based. So if you have any questions or any concerns about your parents' health insurance and you want to reach out to me, feel free to do so. Thank you again for supporting me during this series, Sandwiched In. Please like, comment, and subscribe. I appreciate all the love, support, and prayers. I'm here for you, and thank you for being here for me. Take care.